Good afternoon, everybody. I'm very excited to be here at the World WCN Expo. I'm actually here with another of our founder members, Kalema-Zikusoka, my husband, and we've been working with mountain gorillas for a long time. I personally have worked with them for, I would say, close to 30 years. Shows how old I am. And I started out as a vet student in 1994. I'd always wanted to be a vet, and once I got to Windy Forest, which you can see in the picture, I fell in love with the place, I fell in love with the gorillas, the community, and I've never left. But one of the main reasons why I was hired was because of disease. Everybody was concerned that gorilla tourism had begun, and people were going to make the gorillas sick. We share over 98% material, genetic material, and can easily make each other sick. So in this presentation, I'm going to talk about a need that we have, the work that we've been doing, and how we are going to focus more on habitat loss. And as Zoe said, we celebrated 20 years of conservation through public health. It's been a very interesting journey. How many of you have seen mountain gorillas, actually? Fantastic, many of you. Well, mountain gorillas are so amazing. I'm sure when you saw them, you must have felt like that. They are so similar to us. And when I saw my first mountain gorilla, I felt a really deep connection. And I felt I really wanted to protect them. They have families just like us. The fathers are very protective over the children and the families. The moms are very good mothers. I've learned how to be a good mother from the gorillas, watching them for many years. And the babies like to play a lot. They like to play just like our sons. We have 2 sons. And they like to show off also in front of tourists. We have been mainly focusing on disease because I'm a trained vet, and that's the main reason why we set up conservation through public health when people made gorillas sick. So we analyzed the samples from the mountain gorillas and looked for diseases that they could have. And from these samples, we're able to find out if they're picking up diseases from people or livestock, and then see whether to treat the people, the livestock, or the gorillas. And we have a Gorilla Health and Community Conservation Center. That's our 3rd founder member, Stephen Rubanga, analyzing the samples. How many of you have visited our center at Buhoma? Fantastic. You can see that we have the best view of the whole forest, panoramic view of the whole of Windy Forest. And during COVID, we found out that people can easily make gorillas sick, also with COVID. And we carried out a lot of education about how to prevent COVID between people and gorillas, working with the rangers. And we also continued to carry out this education in the communities where we changed their behavior. We got many more people adopted hand-washing stations during the pandemic, which really helped. And over here, we now get our village health and conservation teams to go to people's homes and turn homes into model households. So homes that were originally, not having hand-washing stations, people don't have drying racks, but now they're getting better, cleaner homes, so that if gorillas happen to go into their compound, they're less likely to get sick. We started out in 2007, 15 years ago, when we had only about, we're reaching 2,000 homes and 26 volunteers, but now we have over 400 volunteers reaching 10,000 homes with 50,000 people. And over time, we're finding that as community health is improving, gorillas are falling sick less often from human diseases, which is really amazing. And that is extremely important, because if we continue to improve the community health and well-being, the gorillas are going to have a much more secure future. And as you can see, they're completely adorable. I was going to put in a photograph of a gorilla that's just been born this week, but it didn't quite make it. I got the news last night. And this baby gorilla was born to a female called Furaha in the Kuringo gorilla group, which faced a tragedy during the pandemic. The silverback of the group was killed by a bushmeat poacher who was hunting duiker and bush pig. And so the group split because they didn't want to be headed by a blackback, Ramutwe. Then he became a silverback, and Furaha has had a baby this week, which is wonderful. And so owing to these successful conservation efforts, which we're proud to have contributed to, along with other partners, the mountain gorilla numbers are steadily increasing, which is wonderful. When I first started working with them in 1997, there were only, we counted 300 mountain gorillas on that very first census at Bwindi, to add to the 350 in Virungas, to make 650. And they were considered one of the most critically endangered species in the whole world. But as we speak now, because of the positive growth trend, as much as there's only just over 1,000 left in the world, IUCN dropped the status from critically endangered to endangered. And so it's all really good, and we're really excited. But we're a little bit concerned about the fact that as the numbers of gorillas are going up, they're in a very tiny protected area of only 321 square kilometers. There isn't enough space for them to grow. And with tourism, which has helped people to coexist with gorillas, comes development. And I think when you come to Bwindi, you see there's a lot of development around the area, and there isn't much space for the gorillas to go, either from the lodges, the buildings, when people come, and agriculture. There's a very hard edge between the community and the park. Almost all around Bwindi, you come across this hard edge. There's only one area where there's a buffer zone for tea. And so you tend to have situations where gorillas are always going outside the park. Why did they do it? Because they used to live, before their habitat was cut, they used to range in these areas. And now they've lost their fear of people. Through tourism and research, they can venture outside the park into community land. So this blackback from the southern sector is going out to see what he can find in community land. And this is a very common occurrence. So when they get out there, they like to eat the bark of trees. We encourage people to plant eucalyptus trees or softwood trees so that they don't have to go into the forest for firewood. But the gorillas love the bark. So, of course, this sometimes upsets the community members because it's their livelihood. They also like eating banana plants. They actually prefer the plant and the stem to the fruit because of the moisture that they get from there. So they destroy the whole plant, and this really annoys the farmers. So this is what you get when you get in those areas where the mountain gorillas are found. Banana plantations just outside the park. So today, I would like you to join us on a journey. This is Bwindi Impenetrable National Park, only 321 square kilometers. It's equivalent to San Francisco and Oakland, actually, together, with the Bay Bridge in the middle, if you can see that area in the middle, which is the Bay Bridge. Oops. And we often find that the gorillas are mainly in the southern sector, and they go a little bit into the north sector, but just at the bottom. Habinyanja gorilla group is always found at the neck. And this narrow neck threatens the integrity of Bwindi forest, because as long as people keep encroaching on that habitat, that neck is going to be cut, and you won't be able to connect the northern and southern sectors. And so we've been speaking to farmers and other community members around that area to see if they're willing to sell their land to expand protected habitat for gorillas. We want to be able to make sure that the bridge doesn't break down so that people can still get between San Francisco and Oakland. And so we've interviewed farmers, and in some areas, especially on the east side, as over 90% of the community members want to sell their land because they can't plant any crops. Even if they try to plant crops, gorillas, baboons, and other wildlife come onto their farms and in their areas, so they're not able to plant any crops. And they really want to sell the land. But it's also a race against time, because if we don't buy it, they're going to sell it to the lodges, because now that COVID is going down, the lodges are beginning to rebuild, and they will still sell it to other people. And then the gorillas will be fenced in. So while we're worrying about that, we're continuing to support the rangers to monitor the health of the gorillas. And thank you so much, WCN, for enabling us to do this. The gorillas are continuing to be, to be healthy, and everything is going well. But we also work with gorilla guardians, who are a group of community volunteers who herd gorillas back when they come out. These are very brave men from the community who, whenever the gorillas come out, they safely herd them back so people and gorillas don't get hurt. They're very... So the original name was actually Hugo, Human and Gorilla Conflict Resolution Team. And I mentioned how we started off with the Hugos in my book, Working with Gorillas, when a gorilla came out of the park and we tried to dart that gorilla to bring him out, and he just kept running, because he was partially habituated. And finally, everyone said, we need a group like the Hugo members. So we're really excited about them. They are very brave. They chase away big silverbacks like him and get him back into the park. And so they have a very important role they play. And during the pandemic, we got them to also herd gorillas back wearing masks. Anyone who comes within 10 meters of a gorilla has to put on a mask. They also collect fecal samples from the gorillas in the night nest, and we are excited and relieved that we've not found COVID in any of the gorillas. And thank you so much, WCN, for enabling us to put up these measures in time during the pandemic. So this is when we celebrated 20 years, and the center was officially opened by the Queen of Uganda, our patron. And we continue to work with the women around the park because of our One Health approach to conservation. They promote family planning, so people have manageable families. They give injections, family planning injections. They really get people to be healthy and hygienic, which in turn helps the gorillas. We also give them group livestock projects. And recently we started this Ready to Grow program, which was again supported by WCN. And even the poacher's wife, who killed Rafiki, was one of the beneficiaries of the Ready to Grow, because she was very, very poor. And her husband was put in jail during that time. We also work with coffee farmers bordering the park, give them a good price for coffee so that they don't have to enter the park to poach and collect firewood. And so all of this is helping to keep the gorillas healthy, but we can only get their habitats secure if we are able to buy this land. It's about 1,000 acres for the first phase, and the community members are willing to sell it. If we don't buy it, they can sell it to the lodges, and the gorillas will continue to be locked in. So I'm asking you to join us in this journey so that we can really raise money to be able to expand the habitat so that the number of growing gorillas continues to grow. There are just 1,000 left in the whole world, about 500 at Bwindi, but if we are able to buy this land, then the numbers will continue to increase as we continue to buy more land. And for more information, please scan to donate through WCN and visit our website and our booth outside, buy some coffee, buy Walking with Gorillas, and join us on this journey and come and visit us for those who haven't been able to visit us in Bwindi yet. Thank you so much.